We knew for a long time that there is an obvious relationship between health and welfare. So we know, for example, that there is a clear relationship between happier people and basically healthier people. What we didn't know for quite a while, and there is a lot of research recently to unravel this, is whether healthier people are also more productive. And further, whether at the aggregate level, health can induce development and economic growth. We are making a lot of progress in making a positive link between health and productivity. It's sort of obvious that happier, healthier workers would be also the ones that are more productive. And so if you want to think about this in the context of low-income countries, or perhaps sub-Saharan Africa, it is clear that workers who suffer from infectious diseases, for example, would be less productive. It's just impossible for them to be physically very active. But also for developed countries. That is why we believe that there is so much interest by people buying a lot of health services, new drugs, and the like, to keep them being healthy and, of course, being very productive. The last part, where we look at the relationship between health and growth, is a lot more complicated because there are many intervening steps from health to growth. It is a very complicated relationship as you go from the micro level, when you look at, for example, the individual effect of health on, say, a worker and its productivity, and as you aggregate it to, say, the state or the effects to the country. But that is something that at the conference that we are putting together on health and the macroeconomy is trying to do, is bringing together a lot of experts in the field, both from the empirical side and the theoretical side, to make some headway on this big issue. We knew for quite a while that this link between health and productivity and perhaps at the very micro level, even growth, works well when we look at, for example, villages. So the study of villages finds that there is a clear relationship, a positive relationship between healthier people and more productive people. Now, when we go to the aggregate level, we have some studies that are from the empirical side that are very broad, that use aggregate data like country data or state data, and find very mixed results between health, the health effects on the macroeconomy. So basically the literature stepped back and now is looking into the micro foundations, is looking at individual people's behavior and how they, for example, take into account health considerations in their lifetime and in making future plans given their expectations of how long they will live. And one of the major highlights of this work is that the micro foundations, these individual decisions, both in developing countries but also in developed countries, matter a lot and dictate a lot about how this relationship is behaving. So all of these issues will be underlined, focused, talked about in this conference. If we observe that there is a positive relationship between health and productivity and growth, government subsidy would play a big role. Obviously, when we think about developing countries, there is not even a debate there. The government subsidies on health is a necessity. And the reason is because without them, we would have tragic outcomes. We would have poverty, hunger, and the like. In fact, there is not enough room for government subsidies. That's why you see all the United Nations and a lot of other NGOs trying to help governments to provide more subsidies. So there is no debate at the low-income countries. Now, for the higher-income countries like Spain, other European countries, and most notably the US, there is a big debate as to what is the actual effect of government subsidies or national public health provision and its effect to productivity. Speaking a little bit about the US where I work, there is a huge debate now, as you may know, about whether President Obama's plan to nationalize public health care is the right one. But this is part of a long research that shows these positive effects. And keep in mind that this particular effort is primarily focused for the underprivileged. So certain group of people in the United States have great access of health care, and actually better health care than this perhaps in Europe, in the sense that innovations of technology can be bought even more expensive in the United States, but are available. But only for a few individuals, or maybe a large portion of individuals, but certainly not the poor individuals. Nationalizing public health care supposedly will benefit the poor. So there is a clear room and role for government subsidies in this case. I mean, there is some concern that the returns from human capital started to slow down, and there may be a point where the returns from this human capital, the investments in human capital, schooling at all levels, university, may actually impede growth, may slow down growth. But I'm a lot more optimistic about this, because in addition to health and human capital being main driving forces of growth, we also have innovation and technology. In fact, a lot of economists know that the key source of growth is technology. And if you look around, it's very difficult to think that we reached a level of diminishing returns, in the sense that innovation is driving most economies, especially most developed economies. And it's hard to think that it's slowing down in any way. Now, if we admit that workers who are educated benefit from higher innovation, so they get more wages, they get more return, then even if by itself the returns to education come down, if we admit that there is some complementarity between education and innovation, then the benefits of technology on being educated is going to continue to increase, I think. So I'm a lot more optimistic than most economists who are pessimistic about the returns to education on this.